my name is Kassandra Romas, and welcome to 30 Medical Minutes. A universal topic of concern is our weight and how to lose it. Our society is consumed with images of slim individuals concentrating on their appearance, but the greater concern of weight gain are the medical conditions that being overweight can cause. Thus, many people are concerned with reducing their weight. Our guest, Dr. Lorraine Maita, is an internist and functional medicine doctor affiliated with Overlook Medical Center in Summit, New Jersey. She is going to discuss the many causes of weight gain, how to determine the best method to reduce weight, and treatment options. This show is for everyone. And now let's welcome Dr. Maita to 30 Medical Minutes. Welcome, Dr. Maita. Thank you for joining me.
Thank you so much for inviting me, Kassandra. It's a topic I'm very passionate about.
Well, that's wonderful. Before we get started, let's tell the audience a little bit about yourself and your practice.
Well, I'm an internist by training, but what I found is that people weren't getting better with the standard of care, and I started to study functional medicine that gets at the root cause of why people are getting ill, and it gets down to lifestyle, because most things are lifestyle illnesses. And that's why my passion is prevention. While I treat many chronic conditions, my passion is prevention, and there's so many different ways to get at health and to help people feel their very best.
Okay, so I said that you're an internist. You're a physician MD affiliated with Overlook Hospital, and is your practice close by?
Yes, it's right here in Summit, and I also have another office in Basking Ridge.
Okay, that's wonderful. Okay, so everybody's concerned about it. Weight gain. I mean, you look in advertising, you look in TV, you look at yourself and you look at your friends. Everybody's always concerned about weight gain. So why don't we start off by saying, what, in your opinion, as a physician, is weight gain?
Well, weight gain is not just what's on the scale. It's your body composition. Weight gain is actually where you gain the weight makes a difference, and fat causes inflammation. It's not benign. It's not just a storage depot for excess calories. It causes a lot of different illnesses. So inside your fat cells, you're producing inflammatory cytokines, which causes illness. Everything from heart disease, diabetes, and high blood pressure.
Yeah, I'm really surprised that you're saying that. I really thought you were going to say that weight gain is due to calories or lack of exercise or eating too many things, but you're saying it's inflammation.
Exactly.
It's inflammation. That really is amazing. And so fat is a cause of inflammation. Is that what you said?
Yes, and it's a vicious cycle. Yes, calories, exercise, all that has something to do with it. But I have so many people in my practice that they eat healthy, they exercise, and yet they can't lose weight. It's a complex metabolic condition, and inflammation makes it very hard for you to lose weight and very easy to gain the weight.
Yeah. What about when you're young, you seem to be slim, but as you grow older, you seem to gain weight? And is age a factor in weight gain?
Age is a factor, but it's the accumulation of your lifestyle choices over time. Things slow down when you age. Metabolism may slow down when you age, but it's a buildup of toxins, it's a lifestyle, it's stress, it's so many other things that cause it. And some people think it's genetic. But
I was just going to ask you that. Do you see certain families seem to have the same type of silhouette, shall we say? But is that a reason for some people to be overweight, that it runs in their family like that?
Not necessarily, because there are people who are born to obese parents and have obese siblings, and their lifestyle choices made it possible for them to be slim. So genetics are just, genes are like light switches. You need to actually do something to turn them on, and you can actually turn them off. So if you have the fat gene, or you can make different choices that will change that.
Well, that's pretty interesting. You mentioned the word obesity. In your mind, where does obesity fit in the weight gain scale here. Some people would like to lose 20 pounds or 25 pounds. And then there are people, I'm sure that you see, who need to lose over 100 pounds. What do you consider weight gain?
Weight gain is any deviation or excess fat. It's a body composition. What is the percentage of fat versus muscle in your body? Because there are people who are thin, but they're thin fat because they have less muscle and more fat, and their fat is sending out inflammatory cytokines and causing all kinds of illness. Inflammation is the root cause of so many different illnesses, like anything with an itis, arthritis, gingivitis, gastritis, but it causes allergies, asthma, cancer, diabetes, heart disease, strokes. So it's not necessarily the weight on the scale or how much weight you have to lose. It's, do you have excess body fat, and is your proportion of fat to muscle appropriate?
Okay, wow, that's really amazing to learn. Inflammation is the root cause of a lot of problems, and you're saying not just your appearance of looking overweight and being overweight and your clothes are too tight, but it's also the root cause of many serious illnesses.
Absolutely.
And they can remain chronic illnesses. It's not that something comes and it goes.
Yes.
So in that case, being overweight is a medical condition that should be everybody should be concerned about.
Absolutely.
Okay, so what do you think causes weight gain? I mean, I know you mentioned inflammation, but are there triggers that cause the inflammation to occur, or for people to gain and be fat?
Yes, there's so many different factors, and that's why it's not just calories in and calories and exercising to burn the calories. Just something as simple as stress. Who doesn't have stress? Stress raises cortisol. It's a hormone that breaks down muscle. Muscle burns calories, so if you have less muscle, you're burning less calories. And it also raises blood sugar and has other metabolic functions, so that it's going to make excess cortisol from stress. It's going to make you fat.
Okay, so how do you spell cortisol?
Cortisol.
Okay, so we're educating our audience that fat causes an elevation of cortisol.
Well, the stress causes
the
elevation of cortisol. Cortisol will mobilize calories to be fight or flight. But where our stress is not running from a tiger, our stress, we're sitting there, we're not burning the calories, thinking about things. So we're mobilizing fat and sugar, and it has nowhere to go, so it gets stored as fat.
Okay, so when we talk about stress being an important factor in our life, are you talking about a bad day at work, or a home situation where people are unhappy, or are we talking about the world condition? What do you, in your mind, consider stress?
Well, that's just it. Our minds perceive anything that's an imbalance as stress. It could be mental. It could be physical. Anything like pain, cold. Women get hot flashes. You can have a metabolic stress by high blood sugar. That's a stress on your body. High blood pressure is a stress on your body. So it could be hormonal, metabolic, physical, mental, toxic, lack of sleep. So stress is not just thinking about something that's stressful.
Okay. Well, this is wonderful for you to define it for us, because I think when people think of the word stress, they really think of the external conditions that will cause somebody to worry a lot, to be anxious a lot. And you're saying that if somebody has maybe a very bad back and they're in pain all the time, that's a type of stress also.
Absolutely. And it's going to set off the same metabolic reaction as if you were thinking about something stressful.
Okay. You mentioned something about environmental toxins. What do you mean by that? How can that cause, weight gain?
Well, there are a lot of things in the environment that actually disrupt our hormones. Thyroid hormone is the hormone of metabolism. It helps you burn calories. And estrogen is a hormone of inflammation. Actually, too much estrogen can make you fat. And estrogen there are things in the environment that act like estrogen. Things like BPA's in plastics. Animal feed has pesticides, and your everyday produce has herbicides and pesticides on it that act like estrogen. They disrupt your hormones. They make you fat. Same thing with hormones that are fed to meat, poultry, and the milk that comes from any animal. They're filled with hormones that made them fat. You eat their flesh or their milk, and then you get fat too. So these toxins build up in our system and they get stored in the fat. Our body wants to protect itself from releasing so many toxins, so it holds on to fat.
Wow. Okay. So I do know that our animal industry does, let's say, enhance the feed of, let's say, their poultry and their cattle, et cetera, et cetera. How do you avoid not eating those type of foods or drinking that type of milk and to protect yourself? I mean, it's worrisome.
Yeah, it is worrisome. That's why there's such a big organic movement now, because then at least you know what they were fed. If they're fed organic feed, you're less likely to get herbicides and pesticides. You can't completely protect yourself, but at least you can cut down on the load. So eating organic or non-GMO or grass-fed, free range, they're all very helpful, but you have to really understand how they use the terms.
Okay, so it's quite true. I mean, when you go to the grocery store, now there's just myriads of products that say organic, from your vegetables to your dairy products to eggs, for example. So are you saying, you're recommending that to avoid environmental toxins, pesticides, herbicides, that you recommend our buying the organic product?
When you can. The Environmental Working Group puts out a list of produce that has the most pesticides and the least pesticides. So if you just Google the Dirty Dozen, those are the ones to eat organic because they have the most herbicides and pesticides on them. There's the Clean 15. It's not so necessary to eat those organic because they're pretty clean. They're produce that doesn't need a lot of pesticides to grow or herbicides. So what I do when I go shopping, and I'm very lucky, the stores I go to, there's very little difference between the price of the organic and the non-organic, and there's much more choice now. So whenever it's possible, I buy organic. I definitely buy the Dirty Dozen organic, and then the Clean 15 I don't worry about.
Okay, well, that's very interesting to hear. So let's repeat. So we're looking into causes for weight gain, and you mentioned that environmental toxins are one of them, and stress is another one. And by the way, talking about toxins and talking about things that we eat, are there things that are external that are toxic as well that we should avoid?
BPA's in plastics, but this is cold water, so I'm not worried about it. If you poured a hot drink into a plastic cup or a cup lined with BPA's, you're getting BPA's in your system, which is a hormone disruptor. So I tell people, don't boil your vegetables in the plastic bag it came in. Don't heat in plastic in the microwave. Try not to, if you're going out where you're going to have a bottle of water and it's going to sit in the heat, use stainless steel, use glass. You don't heat in plastics, and that will really cut down on the BPA exposure.
I'm wondering about makeup. I mean, that's something that has many ingredients in it. Is that a cause for changing the metabolic?
Absolutely.
Or it is?
Yes. They have parabens, phthalates, sodium lauryl sulfate, fragrances. All of these are hormone disruptors. So now there's such a choice of natural products out there that don't contain these toxic chemicals that They're much less expensive. I remember when I first learned about this, I looked for products and they were astronomically expensive and they were hard to get. Now they're everywhere. You can get them in your local CVS.
Okay, so you're saying don't give up makeup, but
No.
just choose the right ones, right?
That's right.
Okay. You know, you
It's
also
not just makeup. It's
well, what?
any
Like what?
hairsprays, shampoos, creams, lotion, all personal care
perfume.
products. Perfume.
Oh, wow. Okay.
Natural essential oils are fine, but when they're made in a lab, they're made as a chemical.
Okay, fine. You know, you also mentioned lack of sleep. Now, I don't understand how a lack of sleep is going to affect you so much that it's going to promote weight gain. How does that work?
Well, when you sleep, you make growth hormone. Growth hormone promotes muscle growth, regeneration, and repair. So just think, if you didn't repair your car, it's going to sputter a little bit. It's a stress. It's also another stress when you don't sleep. So between the lack of growth hormone and the stress of your body to try to function on less sleep, too much or too little is going to make you fat.
Wow. I didn't realize. I mean, I know that sleep is regenerating, but I didn't know what you meant by regenerating. So regenerating is literally making growth hormones.
Yes, and repairing the damage to your cells, the everyday damage. It also, you detoxify the most. Your kidneys work better when you're sleeping because it doesn't have to think about anything else. It just detoxifies.
Wow. Well, what if you don't sleep a lot, but you're just lying there resting? Is that the same thing?
No, you really need to get into the deep stages of sleep to make growth hormone.
Oh, okay. Because you know, a lot of people don't sleep well, have insomnia. So let's put it that way. That's an interesting thought. Does a person with insomnia have a greater chance of having weight gain?
Yes, they do.
They do?
Yes, they do.
Oh, my goodness.
It's such an important factor. In fact, I have some certain diet programs. The only people that didn't do as well as the others were people with sleep apnea.
Oh,
It's
okay.
a very big factor in weight gain.
Wow.
And makes it very hard to lose weight.
All right. So we're talking about a lot of these factors, sleep and stress and toxins and everything like that. What about medicines? What about people taking pills for these underlying medical conditions? Are there side effects to these medications that are going to cause weight gain also?
Yeah, the top medications that cause weight gain are birth control pills because of the estrogen and progestins. They're synthetic hormones. Antidepressants, they're pretty commonly taken. And many people have to take prednisone because they have inflammatory conditions such as arthritis or asthma or serious infections. So all of those can cause weight gain.
Actually, this is a little disturbing in a way to know that something that you take to help you in one area could be a little bit detrimental in the other area.
Absolutely.
So, you brought up the word balance. So once again, we've got to find, or you as a physician have to help us find that balance, correct?
Absolutely. And I'm not against medication. Short-term use of medication has saved people's lives. But long-term chronic use, this is my job, to help people get off these types of medications, to find a more natural way to deal with conditions and to keep them slim and prevent these illnesses from occurring in the first place, or
Right.
reverse them.
Okay. One more factor that you mentioned earlier were food allergies. Now, how would a food allergy promote weight gain?
Well, many of our foods have been genetically modified to withstand heavy doses of glyphosate, which is a pesticide. So we already said it's an herbicide. We already said that makes you fat. That gets incorporated into the food. The foods have been modified also to have more gluten in them, and they disrupt your bowel wall, which they're not broken down as well. It causes inflammation in the gut. They call it leaky gut, but the medical term is increased intestinal permeability. It means things get through the little cracks that shouldn't get in there, and your body perceives it as foreign, so it sets off an immune response, which causes inflammation. So again, it all goes back to inflammation. So these 10 foods that I tell people to try to avoid and then reintroduce to see if any of them are causing inflammation, or alcohol, artificial sweeteners, caffeine, corn, dairy, eggs, peanuts, sugar, soy, wheat, and anything with gluten. I think we did a whole show on that.
Yes, we did. So just to repeat then, Dr. Maita, if you're going to help an individual, reduce weight, the first thing you would do, let's say I'm coming to you and I'm now your patient, the first thing you would do is that you would ask me to eliminate those 10 things from my diet. Is that your treatment process?
I usually start with a detox, which is just eliminating those for 2 weeks and then retesting them. The detox does several things. It helps you get rid of excess hormones that you may have gotten from the environment. It helps you get rid of those herbicides and pesticides and heavy metals or any other toxins that may be causing weight gain. Gets rid of foods that may be causing an immune reaction or sensitizing you and causing inflammation. So it calms your whole system down so you have a clean slate. You test the foods. Most people feel fantastic after the first week. It's just amazing the changes that they go through. So that's usually a first step, because diagnosing what foods you're sensitive to helps you understand how your body responds. And it doesn't mean you can never have them again, but have them less often in smaller quantities so that you reduce the inflammation, you reduce the risk of chronic illness, you lose weight, and you feel great.
Well, it makes a lot of sense hearing you say that. Can you repeat those items again,
Sure.
those 10 items if somebody wanted in our audience to do it on themselves, you would not discourage them from doing that, would you?
No, it's more effective. I mean, I do an online program that actually guides people through it, because you have to know what to expect, but alcohol,
Absolutely.
artificial sweeteners,
Right. Okay.
caffeine, corn, dairy, eggs, peanuts,
Wow.
sugar, soy, wheat, and anything with gluten.
So what's left?
Chicken, fish, lamb, organic beef, fruits, vegetables, nuts, seeds. That's the way we were really meant to eat, not these processed foods.
Okay. So let's continue on. Pretend I am your patient. You're going to set up a treatment of detoxification and from those 10 products for 2 weeks. What else do you do?
I'm going to look at your lab tests. I want to know, how are you processing sugar? Do you have a high fasting blood sugar, hemoglobin A1C, which measures spikes in blood sugar over 30 days, or high fasting insulin, which is a marker for metabolic syndrome? I also measure C-reactive protein, which is a marker of inflammation. The more C-reactive protein you have, we have to look at what the underlying causes of inflammation
Right,
are,
yeah.
which are any one of those things I've mentioned, but
Right.
it also could be an infection.
Oh, yeah, sure. So you have to eliminate other medical conditions.
Absolutely.
So that you can focus in on just whether the inflammation is due to, let's say, the allergens or something.
Then I measure your hormones. If your thyroid is too low, I have to balance your thyroid. You can't lose weight if your thyroid is off. I look at the estrogen progesterone balance. I look at your insulin levels, which also cause excess weight gain, and cortisol levels that we talked about before.
Are women more prone to weight gain than men?
Yes, women are programmed to store fat for pregnancy, so that if there were times of famine when they were carrying babies or when they were nursing, they had excess calories so that they could continue with the birthing process and with nursing. Men, they always get jealous. When men and women come in together as a couple to lose weight, the man always loses double the weight that women lose. It's just the way we're programmed.
Fair.
It's not fair. It's totally not fair, and nobody likes that, but we can still lose weight. It's just that women are more prone. We want to be, we're made to be curvy and to nourish others. So we do it through our milk, and we do it through our womb, and we do it through our food. So,
Well, let me ask you something. I mean, women obviously go through cycles in their life. Does that affect weight gain and weight loss as well? I mean, when young lady becomes a woman, or a woman no longer is able to goes through menopause, does that affect the hormonal balance as well?
Absolutely. We talked about the toxins disrupting your hormones.
Yes.
There's an abundance of estrogen excess. So what that is, we talk the excess toxins in the environment act like estrogen. It makes you fat. So what this causes in women is this imbalance. Estrogen is high in relation to progesterone. So they get PMS, migraines, fibrocystic breasts, cysts in the ovaries, heavy bleeding, irregular bleeding,
Oh, wow.
postpartum depression,
Yeah.
mood swings. And men get listless, they get depressed, they get less motivated, they get big bellies and big breasts, and their prostate enlarges. And this is all this estrogen progesterone imbalance. That's why detoxification is so important.
Okay. Dr. Maita, I know that you're promoting healthy foods and, of course, exercise to go with it, and you have an evaluation of a person's inflammatory and medical makeup. Do you ever prescribe certain medications or pills to help people lose weight?
I rarely do that. Sometimes
You don't find it necessary?
No, I don't find it necessary. Sometimes I'll do a hormone-related diet with using a hormone just temporarily as an appetite suppressant and fat burner, but it's not addictive. A lot of the other medications for weight loss are addictive. They're amphetamines and they rev up your metabolism, but once you take people off of those, they rebound. So I very rarely use medications.
Do you find that what you recommend is a lifestyle change that has to remain in place for the rest of your life?
Yes and no. People deviate. It's not as constricting as one would think, because everybody's going to fall off the rails. I give people tools so that, when you deviate, you just get back on course, just like your GPS.
Okay.
So yes, it is a lifestyle. Being healthy is a lifestyle, but it's not as constricting as one would think.
Okay, so what I've learned from you, Dr. Maita, is that one, we should evaluate, first of all, inflammation causes a lot of our weight gain, and that there are many factors in our environment and externally and internally that we could work around, and that eliminating certain foods from our diet may not be a bad thing to do.
Absolutely.
And your message to our audience is?
It's not as hard as you think. It's easy, you can lose weight, you can feel great, and it's a lifestyle. It's a lot more people want to embrace that type of lifestyle.
Well, I'm so glad to hear that it's not impossible to lose weight, and it's not impossible to think that there's a way to make yourself feel better at the same time, because losing weight means that you're going to feel more energized, you're going to feel better about yourself, which is also going to relieve some of that stress you've been feeling, right?
Absolutely.
Okay.
And they're minor tweaks. So it's understanding the root cause of your weight gain. Once you pull out the weeds, you get a beautiful garden.
Okay. Thank you so much, Dr. Maita, for joining us. And thank you for joining us on 30 Medical Minutes.